Thank you for the opportunity to update on the primary results of the OCTOVA trial. This was a phase 2 trial that ran in 14 sites in the UK, and it evaluated the activity of Olaparib compared to chemotherapy and to the combination of Olaparib and Cediranib in women with relapsed ovarian, fallopian tube and primary peritoneal cancers. As you're aware, this is an area of significant need, as the majority of women who present with ovarian cancer will eventually become resistant to platinum, and treatment-free intervals with agents such as weekly Taxol are then in the order of around 3 to 4 months, so improved treatments are urgently needed. OCTOVA was set up to evaluate two separate evaluations: the activity and toxicity of Olaparib compared to weekly Taxol, and of Olaparib compared to the combination of Olaparib and Cediranib. We initially developed the trial for women with BRCA-mutated platinum-resistant ovarian cancer, but due to slow recruitment, we amended the trial design after 27 patients had been recruited to include women who were BRCA wild-type, and we also extended the platinum-free interval to include patients who were within 12 months of prior platinum. Women were randomized to receive either weekly Taxol on days 1, 8 and 15, or continuous Olaparib tablets at 300 milligrams twice daily, or a combination of Olaparib and Cediranib, and the dose of Olaparib was 300 milligrams twice daily and continuous Cediranib 20 milligrams once a day. We stratified by prior exposure to a PARP inhibitor, prior anti-angiogenic therapy, and also BRCA mutational status. 22% of women had had a PARP inhibitor previously, 30% had a known germline BRCA1 or 2 mutation, and around a third had had prior anti-angiogenic therapy. In terms of the main findings from OCTOVA, we showed that the 3 treatment arms were well matched. The median age of participants was 65, with a median of 2 prior lines of chemotherapy, but a range of between 1 and 7 prior therapies. 90% of women were within 6 months of prior platinum, so a predominantly platinum-resistant population despite the amended trial design. The main findings for OCTOVA were, for the first comparison of Olaparib versus weekly Taxol, there was no significant difference in activity in terms of median progression-free survival, which was 3.7 months for the Olaparib arm compared to 3.9 months for the Taxol arm, with a hazard ratio of 0.93. In terms of the second comparison of Olaparib versus Olaparib and Cediranib, we demonstrated a significant benefit for the combination, with a median progression-free survival of 5.4 months compared to 3.7 months for Olaparib only, and the hazard ratio here was 0.7. This benefit was irrespective of prior exposure to a PARP inhibitor, anti-angiogenic therapy, or BRCA mutational status. The initial exploratory analysis demonstrated that there may be a trend to improved benefit from Olaparib in a BRCA mutated population compared to weekly Taxol, and so it suggests that this combination could be considered for women with a BRCA mutation who have platinum-resistant disease, and the side effect profile may be more preferable for this group, with less alopecia, neuropathy, and diarrhea. So these results really add to the body of data that we have in that Olaparib and Cediranib remain manageable in a platinum-resistant population, and they build on data from trials such as Barocco and Concerto, and we await the results of other studies such as the GY005, which is a phase 3 evaluation of the combination in a platinum-resistant group of women. And we look to see to the future whether this could be a new treatment option for women with relapsed platinum-resistant disease, irrespective of their prior PARP therapy and also BRCA mutational status. Thank you for your attention.